So, the first slide is just to talk about MS, and I think if you want to get CME credit for this, I think there's going to be some questions at the end, and I think one of the questions has to do with which of the disease states have we clearly achieved some form of, or have achieved disease modification, and this I think if there's one entity in neurology that we can say unequivocally we have altered the course of the illness, I think it has to be MS. Again, I think we have seen so many advances in so many different areas of neurology that you could argue we're modifying the course of illness in many diseases because we're treating symptoms, improving quality of life, decreasing side effects. I think of our colleagues in epilepsy and how dramatically effective some of these newer agents are, and how much better tolerated they are than some of the older ones. But in the world of MS, using immune modulating therapy, this clearly has altered the course of the illness, and so in a sense it is, I think, the standard for disease modification. Now, the next slide, it raises the question of whether or not there has been disease modification in Alzheimer's disease, and I'm going to take you way back now. This is Tacrin. This was the first commercially available cholinesterase inhibitor in the United States, and my dad is a retired family practitioner. He used this in his patients with Alzheimer's, and I remember how he used to say that if they survived taking the drug, because you had to take it 4 times a day on an empty stomach, and extremely pro-emetic, and it could cause significant liver disturbances, so you had to have LFTs checked periodically. He said if you survived all that, you actually could see a clinical benefit. And this particular review by Knopman looks at the time or the probability of remaining at home, so basically the risk of being institutionalized. And as you can see in the top here, the treatment groups, or the higher treatment groups, they had a greater probability of staying at home versus patients who were on low dose or no Tacrin, who had basically, if you look down here, is 0.5, so it's about 2.5 years, 2 years, a little over 2 years, until they were actually institutionalized. So the 50% mark versus the treatment group, which was only 25% of them were requiring institutionalization, and these are this was an interesting review, and I think we've seen this in some of our other more recent cholinesterase inhibitors. So, in a sense, if we keep patients at home for longer periods of time, I would argue that's sort of a form of disease modification. Now, it was interesting that at the most recent World Federation of Neurology Congress down in Miami, there was a great review of both James Parkinson's and also Charcot and their contributions to our understanding of the disease, Parkinson's disease, and there was this quote from James Parkinson's after his famous description of the clinical syndrome, where he discussed this whole idea that, on the contrary, there appears to be sufficient reason for hoping that some remedial process may ere long be discovered by which, at least, the progress of the disease may be stopped. And I think that's what we're talking about. And while I would not suggest we have, in any way, shape, or form, reached a point where we can stop the illness, if we can slow it down to the point where basically it becomes an insignificant aspect of a person's overall health, then in a sense that by itself would be sufficient, at least to a certain degree. And we're all familiar with Brock's hypothesis that there is an ascending Lewy body type pathology that begins in the enteric nervous system of the gut and the olfactory bulb and invades the central nervous system and works its way up, eventually allowing us to make the diagnosis of quote-unquote Parkinson's disease when it affects the substantia nigra neurons. But the problem is, of course, is that if we don't find something that halts the progression, eventually it progresses up into cortical regions and contributes to a whole host of complications, including dementia and psychosis.